We were one of the first to identify a mutation in a gene in human cancer, and this gene was called at that time the Rath oncogene. My name is Prem Reddy. I'm a professor in the Department of Oncological Sciences at the Icahn School of Medicine at Mount Sinai. This particular gene, it is mutated in roughly about 30% of human cancers. Patients with Rath mutation, right now, there is no drug that is available that specifically neutralizes the activity. So Rath gene is a very important gene for cell because it works like an on and off switch for cell growth. So when it is on, that means cell is receiving a signal to grow and divide. When it is off, cell is receiving a signal that it should not divide. And when this gene is mutated, it is permanently stuck in an on position. So it is receiving signals continuously from this gene that the cell should divide and grow. We have been trying to develop drugs that neutralize this activity of this drug. That means somehow turn it into an off position. And this has been extremely difficult to achieve, simply because this particular protein doesn't seem to have pockets where a drug can go and bind. All these proteins have a protein sequence called Rath binding domain. It is like two Legos that have a perfect fit. So all these proteins that bind to Rath have this particular Lego-like structure that can go and attach themselves to Rath protein and receive the growth signal. We started investigating whether we can develop drugs that can go and bind to the so-called Rath binding domain of these cellular proteins. And rigosertib is one of the first molecules that has been found to bind to these Rath binding domains and block their attachment to Rath protein. So now, even though the Rath is on, in an on position, these proteins are unable to bind to Rath and unable to receive growth signals. So this is one way of turning off Rath. These cells have become addicted to Rath to grow. Once the Rath signal stops being given, they also start dying instantaneously.